Hello, everybody, and welcome to Postpartum Perspectives. I'm Julia Kavanaugh, and I'm one of your hosts. I am a birth doula, postpartum doula, and newborn care specialist.
And I am Nancy Ham, and I have Gentle Ventures Training Center, and I teach newborn care specialists, holistic newborn care specialist, and I just started a nanny course for up to 4 years old. So I am so glad that you're here to join Julia and I. I'm sorry that we have been absent for a little while, but I think Julia has something that she wants to tell you.
Oh gosh. Well,
Do you? If you don't, we can cut it.
yeah, no, that's fine.
Oh, okay.
Also, we both run Postpartum Doula Academy. Didn't mention that, but
Oh,
we do.
yes. Sorry.
Yeah.
Yes.
Um, yeah, no, my news. So I'm pregnant, which is very exciting. Um, and the first trimester just really was, it's a lot and it makes you very, very tired.
Tell us about it.
So,
Tell us about your first trimester. I think that'd be interesting for our followers to be able to follow you through your
oh,
pregnancy. What's normal? What's not normal? We were
oh
just
my
talking about
gosh.
your little cough and your congestion and things like that. And is that normal or is that?
Oh yeah, I mean, well, it's so interesting because there's so many things that can look like a sickness, and it's like, oh no, that's actually just part of pregnancy. Like, I've been congested since the first week of pregnancy, and apparently congestion is can be one of the pregnancy symptoms. I have my allergies that I have always been allergic to, but have been kind of under control. I'm just a little more heightened in my allergic responses to them. Um, uh, Body issues coming up, but like just trying to practice gratitude to my body for growing the baby. And, when you're, you have this Instagram idea of what your body's going to look like. And then when you see that it's a lot rounder than you expected and a lot more squishy, you're like, wait, this is not what Instagram promised me. Apparently that's also completely normal. So, um, so no, it's just huge growth opportunity and super grateful.
How
But
about
we took a little break.
how about like your activity level?
Oh
That
gosh.
are you? Is it down? Is it up? How about your sleep? Is it down? Is it up?
My activity level is definitely down.
Okay.
Um, I've, I mean, I try to make it a point to get out and, do a 20-minute walk, 20 to 30-minute walk a day. I'm doing some, those pregnancy workouts online. I do that like a few times a week. Um,
You know, they say that if you're doing something before you're pregnant, don't quit doing it.
yeah,
So, like if you're horseback riding before you get pregnant, don't not get on a horse because you're pregnant.
yeah,
And so
that's right.
that's something that I always, when I was pregnant, I tried to remember. I guess that's an old thing because that's something I always did. If I did it before I was pregnant, I continued to do it.
Did
But
you do
you're not
horseback
supposed to
riding?
start. Yeah, I did actually. But
Oh,
you're not supposed to start anything new. You're not supposed to learn a new physical activity per
that's
se
right.
because your
That's right.
body is not used to it. So
That's
I,
right.
I don't know if that's true anymore, but
It
that's
is. It is that they told me the same thing.
oh okay.
So,
Okay.
so yeah, it's still true. Which actually, Nancy, this kind of bridges into the topic that we're talking about today, which is like things that we were taught as professionals that used to be true. And then as we learned more and as studies came and knowledge evolved, now we don't practice them anymore. That's what today's topic is about.
Yes.
And I mean, I can start with one
Yeah, go
if
ahead.
I'll
Go
start
ahead.
us off. One of the things that so I was recent, I'll tell you the story. and then no, I'll tell you the thing and then I'll tell you the story.
Okay.
Uh, it's 1 hour for every ounce that you feed a baby that should make them feel satiated for that amount of time. Now, I don't exactly remember where I learned this. I've taken lots of different trainings. It wasn't in your NCS
No,
class.
I've never heard of that before.
No, but it made so much sense to me.
It
And
does. It does make sense.
thank you. I went on and I taught it to my clients.
Yeah.
Um,
I taught it to my clients too because I always told them by 4 weeks they should be
yeah,
drinking 4 ounces.
interesting.
Why did
Yeah,
that make sense to me? I don't know
yeah,
where I got that.
yeah. Okay, so maybe I think it's kind of been circulating in the consciousness of people in this world. So, um, when I looked it up, so we don't do that anymore, guys, by the way. I recently learned this after talking with a client of mine. Um, and uh and I gave that information and I was like, you know what? Let me just double check that this is still what we're teaching. And sure enough, it's changed as of the 2010s. It started transitioning out. So it started in the 1940s.
Wow.
Uh, and it was part of the hospital's way during that time of creating predictable clocked-based feeding. So when you think about all the newborns that nurses had to take care of in one newborn area, they would want to know, okay, that baby just had 2 ounces, and so they're good for 2 hours, and I just changed them, and they're warm. So if they're crying, it can wait, right? That kind of reassurance.
Mhm.
And that lasted till the 70s.
Okay.
Uh, and then it started to transition out more, but because it was so much a part of hospital protocol, it circulated out into the public and it maintained itself in the public. Um, and what we're teaching now is more that babies are not robots. 1 ounce in is not necessarily going to sustain a baby for an hour. Some babies it might, and on some days it might, but some days the baby might be going through a growth spurt and they might need more than that ounce for that hour, right? So now we're really moving away from the bottle feeding culture. Even when we're bottle feeding, we're moving away from the culture of bottle feeding, which really is all about like visible volume. And we're really focused on the numbers. And we're moving towards infant biology and watching the baby and picking up on their cues for when they're hungry, which is, it's just, it's just an adjustment for those of us who are in this world of helping parents with schedules.
So are you saying that scheduling is out?
I'm
Don't say that. Don't make
I'm not
don't
I'm
make your
not
lips say that.
completely saying that it's out. I'm saying that responsive feeding is in and cue-based feeding is in. So
Okay.
we're moving, yeah,
Okay. And I can agree with responsible. In fact, I've got a subject that's called responsible feeding, which
yeah,
is you try to stay on a 3-hour schedule. However, if the baby's starving at 2.5 hours, you don't say you have to wait 30 minutes. You go ahead and feed them.
right, right.
But there are some people that are definite. I'm going to feed my baby every 3 hours, and actually they can make that work. The babies will generally conform to that. But
Yeah.
you're saying that we're trying to move toward a gentler type of baby care.
The industry of lactation
Yeah,
is moving towards responsive feeding and cue-based feeding. And this is especially true for newborns.
yeah.
So like before the first, I mean, definitely in the first trimester, but like especially before the first 4 weeks
Hmm.
have, um, so noticing, is the baby rooting? Is the baby putting their hand to their mouth? Are they licking their lips? All those little cues versus, oh, well, it's only been this amount of time, they can't eat yet.
Right, but also in that, and this probably doesn't have anything to do with it, but you have to make sure the baby's getting a full feed. If you're feeding the
Yeah.
baby a quarter of what they are supposed to get, yeah, they're going to be hungry in an hour, and you can't overlook that. But if you're giving them a full feed, which is 2.5 times their weight divided by the number of bottles they get a day, gives you the number of ounces they're supposed to have, then you know they're getting a full feed. Then it's a little easier to say, okay, you're fussing and it's 2 hours and 45 minutes. I'm going to put you off for 15 more minutes because you did have a full feed last time. Or if,
Yes.
or if they're starting to fuss at 2 hours, it's like, oh, no, 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 no. We're going to soothe a different way. This is not a feeding cry.
So this is the tricky part because you're right, like that way does work. I've worked with babies where we've done that and it's worked great. Um, but the lactation field is moving away from that. They're moving away from
Of course.
the the numbers and the calculations because the idea is we want to focus on infant biology, right? Which is much more, it's baby led, right?
Baby led.
It's
Mhm.
it's this idea that babies are sometimes gonna like just like humans, sometimes we'll want to breastfeed, just like humans, just like adults.
Just like adults,
Sometimes,
we want to breastfeed sometimes.
no, I mean, like
Go ahead and
sometimes
explain that one.
babies can only get liquid from breastfeeding. So they might be thirsty and want to have some milk. This is the thought, right? For in the lactation field.
Okay.
Babies nurse for more reasons than just hunger. They nurse for comfort, they nurse for a
Security, love.
nervous system
Yep.
regulation, they nurse for thirst. So the idea is respond respond and give them what they're asking for. And it might not, if you're not seeing a suck swallow, then it's comfort and you can use the nipple. But if you're seeing a suck, swallow, then they are actively getting something from breastfeeding. And that's when you want to continue to offer the breast until they're done. But this makes it really hard if you are a parent and you want to also not have to watch the baby's cues.
If you have siblings, if there's siblings in the house, it makes it really hard. If mom is
Yeah.
working, it
Yeah.
makes it really hard.
Yeah. Yeah.
So yeah, the old school is not baby led but mother led,
Yeah.
and the new school is starting to be baby led and not mother led. And
Yeah.
honestly, for the sanity of the mom, I like mama led, not baby led. That's
Yeah.
what I like. That's old school, and I know I'm old fashioned, and I'm not, yeah, and I'm not popular in the lactation field. But that's because
Yeah.
I honor the mother's sanity. To
Yeah.
have a newborn, especially if she doesn't have help, if she had, or if there's siblings in the house, or if she is still working full time at her computer, she has got overload going on. She's not getting enough sleep at night.
Yeah.
And I definitely feel like mother led is, and a baby's not going to starve. A baby, she can wear that baby,
Yeah.
she can wear that baby. But yeah,
Yeah. And just because the field is saying this is important, like we have to honor the biology, which is
right.
where I lean towards.
Yes, you do.
Um, the when you look at human history, like from the 40s to the 70s, it was working in the hospitals and then they started moving away from it, but it still lasted up until, I mean, it's still out there. This idea of like you give the baby enough milk, 1 ounce, 1 hour, like that kind of mentality is still in our psyche because it worked,
And if you
right?
want to look at the generational, the
Hmm.
40s to the 70s is like, that's more than a generation, but it's a couple of generations. And then look at the generation that we're producing today.
Yeah.
It kind of makes you want to go back to the 40s and 70s
What do you mean? What do you mean?
on the psychology of these kids that are coming out, the
not because they're getting biological milk needs met though.
That's because it's baby led and not mother led. And that's
I hear
because the
you.
baby's led up until they're teenagers and they're still being kid led and not mother led.
Ah,
That's
that's
what
interesting.
you have to if you're going to do baby led, you have to morph us out of that to where
Yes.
you become the person in charge and not the baby and not the
Yeah.
child.
Yeah, I agree. I
Yeah.
do agree with that.
Okay,
That's
we
really
need to move
interesting.
on unless
Yeah,
you have
what's
something else.
yours? What's
Okay.
yours?
So I'm going to talk about something that we used to do when I started. Now I've been in this for over 30 years, but it was taught to me in class. Um, and it's the idea of it is good. It's just how it was generated that was not good. And that's the reflux nest. We used to build reflux nests for babies in cribs. And people look at you now and say, what's a reflux nest? Well, a reflux nest, first of all, if the baby has reflux, you're supposed to put them at a 35-degree angle so that the stuff that's coming up does not come up, but instead stays down. And so you hold the baby at an angle. Even when you're done feeding a baby with reflux, you're supposed to hold them at an angle. So
Yeah.
instead of holding them all night, we'd put them in what we called a reflux nest. Now, a reflux nest, what we did was we took a pool noodle or a towel that was rolled really tightly up, and we would make it into a U. The bottom part of the U, their little butt would sit in, and this U would go under the fitted sheet of the crib. So you had a U, and you sit the baby in that with their little butt on the bottom part of the U. And then you put boxes or whatever under the mattress to lift the mattress to the angle.
Yeah.
And
Yeah.
it worked really good, except for one thing. The babies would wiggle and squiggle and roll out of the U and down to the foot of the bed.
Oh no.
So that
Yeah.
was really scary. But it did work as far as keeping the stuff down that was supposed to stay down. So we did that until the baby stay asleep came onto the market. And it is a fitted sheet that goes over the mattress that has a harness in it. And the harness has straps to strap the baby in. And then you still can put the mattress at an angle with pillows or whatever you want under the mattress.
Yeah.
And the baby is at a 35-degree angle.
But
And
even now they don't like the 35-degree
but now
angle.
they decide they don't like the 35-degree angle. And I know, and you know, the
Yeah.
benefits of it.
Yeah.
I've had babies that can't sleep unless they're at an angle. And I'm not going to sit there, and neither is a mom going to sit there all night and hold her baby at a 35-degree angle so the baby can sleep.
Yeah.
So that is another thing that came on the market. Now they're deciding, like you said, that they don't like that,
They
but
want babies to sleep flat. That was the last thing that I
sleep flat.
saw.
But
Yeah.
I'm not real sure that the American Academy of Pediatrics has actually looked at this design
Yeah.
because the babies can't slide. They are sleeping flat, but they're
Yeah.
flat at an angle.
Yeah, they haven't mentioned the baby stay asleep
No,
in the literature that's like we don't want the baby because they don't want the babies to slide down.
they don't
Right?
want the baby
That's
to
the
slide.
whole idea. They don't want
Right,
that. But
right,
this prevents that, but they don't mention that in the literature
yeah.
about yeah.
So we have not we. I know I've made up my mind. I still recommend the baby stay asleep to
Yeah.
every mother that's got reflux baby, but
Yeah.
I'm not sure that the American Academy of Pediatrics recommends that.
Yeah.
And in fact, I know that they're saying babies need to sleep flat and not at an angle.
Yeah.
Um,
Yeah, that's a
so
pretty big one. That's a
that
pretty big
that is a really big one. And while we're on reflux, let's talk a little bit about how different it was when I started and
yeah.
babies were getting Zantac all the time. I mean, it was like I would say that
And what is Zantac?
Zantac is a drug that actually, just a minute, I can tell you exactly what it was supposed to do, and I think it's just supposed to keep the baby from spitting up. Where are we?
I think you're right.
It's a real basic, and it was like the first thing the doctor would put the baby on. That was the bottom line of the bottom line of the drugs they gave. They gave Pepsid and Zantac, and
So
okay,
it's a receptor blocker
it's
and
an H2. Mhm.
it reduces how much stomach acid is produced.
Right, and so that has been totally removed, totally removed.
Wow.
And I don't know if you have ever heard of Reglan, but Reglan is a black box medication that they also gave for reflux quite regularly.
Oh,
And that has been removed. They can no longer give that. And there's probably out of the one, two, three, four medications, three of them have been removed.
wow. Oh, I see here in 2019 and 2020, ranitidine was pulled from the market. That's the other name for Zantac
Zantac, yeah.
because it can break down something called NDMA, which is a probable carcinogen.
Yes, that's what I have here.
Oh
And
man.
then another one that they gave was withdrawn in the early 20s because it caused fatal heart rhythm disturbances. I mean, these things, all four of these um, prescriptions were given out very, very regularly. But now we look at Zantac a little bit, Zantac, we look at reflux a little bit differently. We go
Yeah.
in and we do more natural things, or a lot of people do more natural things. I'm sure there's some people that still have their babies on drugs, but a lot of people also do things more naturally, like check and see what the mother is eating, because
Yeah.
what's going in has got to be what's causing the issue. If the baby's on a formula, maybe we need to change formulas. Maybe we need to check and see what the mother is eating. Maybe we need to put the baby at a little angle. Maybe we need to. There's a lot of things with reflux that we do now that we used to just give them a drug for and
Yeah.
sleep them on their back.
Well,
You
and
know,
we know now that it's also like that's more of the what you're talking about with the uh testing to see like, oh, if what mom changes if she changes what she's eating, will that help? If the baby formula is changed, will that help? That's more allergy based,
it
right? Is there
is.
like a
It is.
sensitivity?
Yes.
Yeah, but I think recently we've started viewing reflux as more of a mechanical issue, right? Caused by like an immature esophageal sphincter.
Right. Does not open when it's supposed to. It just stays closed until the food comes back up again.
Right, right. And the
Yeah.
esophageal sphincter is that little flap that keeps the stomach, the food that's in the stomach and not in the throat.
Mm-hmm.
So if that doesn't close properly, the food can come back up.
Yes.
Um, and it usually peaks around 3 to 4 months,
Yeah.
which
So
is really surprising because you would think that it would be the worst when they're newborn and they don't know how to operate their bodies effectively yet. But when it starts to peak between 3 to 4 months, as a parent, you're like, well, something must be wrong because this thing is happening when really it might just be, or we're being told now that it's a mechanical thing that happens between 3 to 4 months
right.
and
So
improves on its own.
so I think the most important thing here is to realize if it's reflux or if it's an allergy,
Oh, yeah.
because they act an awful lot like the same thing. The baby is squirmy. The baby is can't
Same
settle.
symptom.
Yeah, they can't settle. They have spit up. They're a lot of the same symptoms, but one is just an allergy, which I don't mean just an allergy, but an allergy is easier to take care of than the actual mechanical thing that goes wrong with that sphincter not closing.
Wow. Yeah. 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 It's
So
tricky.
yeah, it's very tricky. But if you have a baby that you suspect has something similar to reflux or allergies, the first things I would do, well, you can always go to the baby doctor and have the doctor check,
Yeah.
because the doctor can check and see if that sphincter is closing or opening or not doing its job. But they,
Mhm.
but that also is a test where they stick the little tube down to the baby's tummy, and that,
Oof.
yeah, and that's not a fun thing to do, and they don't
No.
want to do that. So they're probably gonna just say, well, it looks like the baby has reflux, or it looks like the baby has allergies, and
Yeah.
then you can go from there by, if they're allergies, then you can go by changing the formula, trying changing the formula, try taking gluten and dairy out of your diet if you're breastfeeding.
Mhm.
Just simple things that can be done that can make a big difference.
Yeah.
So
Yeah.
yeah, and Julie and I both, we had a client that was baby had severe reflux. I mean, she was getting hives. Was that reflux or was it allergies? What did it ever
It
turn
was
out to be?
allergies. It was
It was
really,
allergies.
but it was allergies to many, many, many different foods.
She was like allergic to, we couldn't find a formula that fit her. Her mother's breast milk didn't fit her.
Yeah.
Nothing fit this baby. It was, to
Yeah.
get her to 2 years old was a lot of work. And I don't know how
But
she's
she
doing,
did it.
but
She
she did.
did it. But part of what the family had to do was just acknowledge, like, okay, she's gonna have hives. She's gonna have rashes. Like that was just a part of the maintenance until she was able to eat solids. When she was able to eat solids, she had a very limited diet because there were very few foods that didn't make her break out. Um,
And it doesn't happen very often. I'd say that was one in one in a million type of
it
thing.
was rare. It's a rare
Just
thing.
doesn't happen.
Yeah.
So, okay,
So,
Julia, what's your next?
um, yeah, let's do a couple more. I'll do
Okay,
one, you do one, and then we might break this into another episode if we feel like it.
okay.
Um, so the next one that I have is breast care as as doulas and NCSs who support moms who are breastfeeding, um, specifically when it comes to clogged ducts and mastitis. So up until I don't know when the rules changed
Real
exactly.
recently.
Like I feel like within the last year,
Yeah, it's been real
within the last
recent,
few months.
because I'm still fighting you on it.
Yeah.
I still don't
The
agree, but I
yeah,
see your logic, but I still don't
I
agree.
know,
Yeah,
because for so long we were told
yeah.
that if you want to help a mom get rid of a clogged duct, you apply heat to help open up the duct so that the clog can be removed. And then the baby will suction out the clog. Now we are completely shifting the advice to the opposite. You want ice because the lactation world is seeing that we don't think that clogged ducts are actually caused by clogs in the milk. We believe that clogged ducts are being caused by inflammation of the duct itself. And the inflammation can come from overstimulation of the breast, like pumping too much or too hard. And that's actually one of the major causes of this. So when the inflammation starts, if we apply heat, what does heat do? It expands. So it will expand the inflammation to increase it, making it harder for the 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 milk or whatever little clog has formed to be evacuated. So now we're saying apply ice to the breast and then do something called lymphatic drainage, which is like a gentle, let me see if you can see. It's like a sweep of the breast up towards the clavicle and armpit. It's like you're petting a cat, which is also the opposite direction that we've taught moms to massage,
Yeah, you always
right?
massage down.
Right. And now you don't do that. Now we want to lymphatically drain the breasts to help decrease the inflammation. And and have baby eat. But we don't want to overpump. We don't want to use a massager to help break down the clog. And this is a big shift.
How about the nursing with the chin pointed toward the lump? That's
That's
okay.
still
Okay.
great. Yes.
So great. Okay.
That's still great. Yeah, Nancy's referring to the um the protocol where you have the baby angled where their chin is uh pointed towards wherever the feeling of that clogged duct is. And so when they're in that position, they'll be able to effectively remove the clog while they're eating. Yeah. I was on a job in 2 years ago. I was on a job 2 years ago, and one of the mom had a pretty bad clog, and we called her lactation consultant. Lactation consultant said, um, do ice. She did say do ice. But then she said alternate between ice and heat.
Yeah, that's
So
what
we
they,
were doing both.
yeah.
And then the clog developed further into like mastitis. So then she called her doctor, and the doctor said, "Oh, you should only be doing heat." So then she only did heat, and then it got worse. And this poor lady, um, like just different medical professionals are like we're so used to whatever we were taught, and keeping up with the changing times is a it's an active job.
It is a very active job.
Yeah.
And now, especially with AI jumping into the game, we
Yeah.
see a lot of posts on Facebook that are, I'll say it really nicely, BS.
Yeah.
And
Yeah.
you're just like, people are eating this stuff up and they're saying, we can't do this anymore because here's and then you put this article into, I still put it into AI and I say, is this a true article? And it will come
Yeah.
back, well, some of it is true.
That's okay.
Most of it is not true. And then they'll
Yeah.
break down what is true and what's not true. So if you
Yeah.
see something on social media, even on Instagram, man, all these people have all these opinions just like us.
Yeah.
Put it into uh, like a chat GTP and say, is this true for now? Or is this true now? Uh,
Yeah.
and you'll get a pretty good answer. I did this for breast milk storage this morning
Oh,
because I remembered that when I started, we could leave breast milk out for 10 hours. No
yeah.
problem whatsoever. Now it's down to 4 hours, I think 4 or maybe even 2 hours.
It's for
Or
as long as the baby hasn't
to
drunk from
turn
the bottle.
taking anything out of the bottle yet.
And then
So
it's two.
yeah, so I said to AI, could you please give me a comparison from 10 years ago till now? Well, oh yeah, no problem. No, the standards have not changed. And I said, bullshit. I said, bullshit. The
Yeah.
standards have not changed. Redo this for me. And they came back with, yeah, no, the standards are the same. I know that's not true because I specifically remember when I started this class, it was 10 hours. And that was in 2012, six or 12, six. So that's been more than that's 20 years ago. But it still was not 4 hours in 10 years ago.
So AI is like gaslighting you.
You gotta be very aware of what you're doing and know kind of what you're looking for
Yeah,
in order to make that happen.
that's
We can
crazy.
do one more quick one, and it would either
Yeah.
be vaccines or noise machine level. Which would you?
Ooh, let's do vaccines.
Vaccines is really, really interesting because the CDC and the AAP have got different ideas now on what a newborn should receive for a vaccine and what is necessary. The
Yeah.
AAP is staying with their old schedule, which means Hep B is given in the hospital. The MMR is given. I don't have the time for the MMR, but I think it's a little later. I think 6 months or something like that.
Double
Uh,
check.
and the tetanus shot is still given. And let me see if I have the DDP. Okay, well, I'll tell you what is not given anymore. That's easier.
Measles, mumps, rubella is given at 1 year old,
At
between
1 year.
1 to 15. That's the first dose.
But that's
Second,
but
yeah.
that's not CDC. CDC is not recommending that anymore.
Oh,
Just the
okay.
AAP is. The CDC
Oh,
is not recommending hepatitis A, COVID-19, influenza, or rotavirus, any of those anymore.
the CDC?
The CDC is not recommending.
Huh.
The AAP is recommending them as routine vaccines. So
Uh-huh.
that's a big change that's happening. Now in Florida, um, they vaccines are not required at all to enter school to do anything. You cannot keep somebody from a job or from school for not being vaccinated. So
Wow.
I think they're the first state that has put this into play full time, stop, well, nonstop. But just be aware that the AAP and the CDC are two different entities who are at this point not agreeing with each other as to what is necessary, what is not necessary. I, being a non-vax person, tend to go with the CDC. The less, the better.
Yeah.
And if you're going to do anything, space them out.
Yeah.
Space them out. Don't put all those vaccines into that little tiny body. It's just so many.
Oh, I'm
Go ahead.
I'm checking something out real quick, Nancy, while you're explaining this. This is
Okay. And
so yeah, keep going.
okay, I was going to say, I think I said the Hep B was not
Yeah.
okay. Hep B is not recognized anymore by the CDC for newborns before they leave the hospital. I'm just looking here to see if I forgot anything.
Okay, so recently in the news there was a report about a 15-month-old who died 2 days after a well visit where multiple vaccines were given. Um, and it was noted that the temporal link, the timing link, but it did not establish that the vaccines caused the death. Correlation does not equal causation. I thought that I, but I thought that I saw somewhere that these parents fought really hard and that there was a link acknowledged.
Yes, and they can bring it to the vaccine board,
Yeah.
which is it's not associated with the doctors, with the pharmaceutical companies, with anything. It's just a board that reviews all the facts in a case and
Yeah.
determines whether the parents can actually, uh, not that it makes a big difference, but recoup a lot of money for the death of a child or the
Yeah.
injury of a child because of vaccines. So that could have been where you read that
Okay. It's
kind of
yeah, it says the public health agencies do acknowledge rare adverse events linked to certain vaccines,
yeah.
but they don't acknowledge a general causal link.
And the thing is, and just to bring this up, if your baby has its first shots and there's an adverse effect of any kind, be very, very careful getting them their next round
Hmm.
of vaccines. Be very careful. Whether if you say, well, I still want my baby to have them, then just one at a time. Just one
Yeah.
at a time and space them out. Because if they already have had a reaction, that means their little body is saying, this is not for me. So be
Wow.
very, very careful. We kind of
I'm,
know. Go ahead.
well, I'm seeing here that okay, these are acknowledged risks and but they're still considered acceptable for the MMR and MMRV vaccine. It has been tied to febrile seizures,
Yeah.
which occurs between 7 to 10 days after the shots due to the fever, not a brain injury. Um, they're frightening, but they don't cause long-term harm. So the risk is slightly higher with the MMR combined vaccine versus the separate MMR and varicella. And then the rotavirus vaccine has the clearest causal link with oh my God, bear with me, guys, intussusception, um, which I don't really know what that is. 1 in 5 cases per 10,000 infants, and it usually happens a week or two after the dose. But the risk is explicitly stated and actively monitored. Um,
So if my child, this is personal,
yeah,
doesn't mean anything for you, but if my child had one of those, a seizure or any other, I would not take him back for any more vaccines. I would get them,
yeah.
what is it called when you don't have to take them anymore?
Exemption.
Exemption. I would get them an exemption and not do it anymore.
Yeah, yeah,
Because that to me, that's a little sign saying, be careful, there's something not working here, right?
yeah. The body's already having a
Some kind of
reaction.
reaction.
Yeah,
And it can only
yeah,
get worse, so let's be very careful.
yeah. Well, that's how it is with allergies, right? Like the first time there's a reaction, second time it's a little worse, third time it can be
Yeah,
really bad.
yeah,
Yeah.
yeah.
Oh, okay. So, I mean, we can do another episode about this,
Oh,
guys. There's more things.
yes, I've got a whole list of things here that are different now than they used to be.
Yeah.
And not only for NCSs, but for parents also, that they need to know that maybe they're practicing things that are a little outdated. And I know we all are. It's just
Yeah.
kind of what we're used to doing, and we just do it, and we don't think sometimes I need cold instead of heat on my breast. You know,
Well, and it's information's always changing. We're always evolving.
it
We're always
is.
learning. Um, so I think being able to be adaptable in our field is a sign of maturity. And and so I encourage all of us who are in this field. I hope you don't feel like you've done anything wrong if you've been practicing any of these things. Like it's so were we. And we all get to grow with the times.
And that's what makes you special. When you are the one who's leading the field and showing people how to do, this is the correct way to do it. We did it this way yesterday, but we were doing it wrong. If you
Yeah.
can take that step and say, this is now the correct way to do it,
Yeah.
you're going to go far in this industry. People are
Yeah.
going to say, you need to get what's her name because she's really up on everything.
Yeah. Yeah. Stay up to date on the news
To
for
medical
our
news.
industry.
Don't step a date in the other news. Don't even
The
bother.
other news, don't read it.
No,
It's
don't
it's
go
it's rough out there. Thank you so much for listening, everybody.
there.
We'll see you next time.
Thank you and bye.
Bye.